Hello, my name is Annie Chung, and this study explores the effectiveness of a hybrid occupational therapy intervention on breast cancer. Cancer is the overproduction of cells. The most common form of breast cancer is ductal carcinoma. It occurs mostly in women but may develop in men as well. It can occur in one or both breasts. Signs of breast cancer are a lump or a change in the breast, and it may spread when the cancer gets into the blood of the lymphatic system. The aim of the study is to compare the effects of a hybrid intervention called managing participation with breast cancer after breast cancer on women's participation in daily occupations versus standard care. The occupational barriers compose of physical, cognitive, and psychological areas. For physical, it includes fatigue and limited range of motion affecting activities that require full use of upper extremities such as bathing and grooming. Cognitive symptoms include reduced memory, attention, and executive functions due to the cancer itself and chemotherapy. When getting diagnosed, experiencing symptoms of cancer, or fear that the cancer would return, it would cause people to feel anxiety and depression. It adds to the challenges individuals face when getting back to their roles and daily routines after breast cancer. For this study, the inclusion criteria composed of women with stage 1 to 3 ductal carcinoma who were 3 to 24 months post-diagnosis. They had to have completed their primary adjuvant therapy, were previously healthy, and reported difficulties or decreased participation in daily activities compared to before they had breast cancer. Exclusion criteria included people with severe neurological, cognitive, mental, or orthopedic disability affecting their daily functioning. For those who were able to be in the managing participation of breast cancer intervention group, they were entered into a 6-week program alternating between in-clinic and telehealth occupational therapy sessions. There were 12 total sessions where the women learned strategies tailored to their occupational needs and goals that each woman found important. The occupational therapist helped them with strategies for self-management, cognitive and metacognitive retraining, biomechanical and motor function support. They were also able to use the Cognimotion 3D telesystem to capture movements of the upper extremities while they played virtual games and performed tasks. This system was used to improve the client's movements in their upper extremity and cognitive abilities. The control group did not receive occupational therapy intervention during the study. They only received standard care. There were various outcome measures used, such as the Canadian Occupational Performance Measure, to measure perceived performance and satisfaction with daily activities, activity card sort, where the client would score their activity level on 89 everyday activities, and a score below 100% would show that their participation decreased. The functional assessment of cancer therapy for breast cancer measured health-related quality of life by looking at 5 areas of well-being, such as physical, social, family, emotional, functional, and additional concerns to be scored out of 148 to determine their quality of life. Montreal Cognitive Assessment looked at general cognition, and the behavior rating inventory of executive function is where the client had assessed their own executive function. The Quick Dash assessed the client's arm function, and the hand dynamometer measured their grip strength. The study used a randomized control trial, which is considered a high level of evidence as one of their strengths, another being that it had high feasibility and retention from the hybrid structure. The study design helped many of the clients to complete the study, so it gives confidence that this is applicable to others beyond the study. It also enabled women to receive more treatment because of the hybrid model. Some limitations were that there was a small sample size of 35 women. Only one health service provider in a specific geographical area was used, so it limits how it generalizes to other areas. There wasn't a formal satisfaction survey done to learn what clients thought. And lastly, it did not account for socioeconomic status or specific medications that the clients took. Yes, I would support use of this article because Hybrid MAP BC took a client-centered approach to tailor the intervention to the women's daily needs and goals that resulted in improved participation. In terms of implications for occupational therapy practice, it encourages providers to include occupational therapy interventions as early as possible after completing cancer treatments to increase participation. The study adds to the foundation for other interventions to be conducted through hybrid to increase access to occupational therapy for other cancers and conditions. Here are my references, and thank you.